This video will be showing the surgical technique of lens aspiration in subluxated lens. This patient is a 6-year-old child with bilateral temporal lens subluxation, bisecting the pupil with broken zonules. What are the goals of surgery here? First is to remove the lens completely. Second, to avoid any lens matter drop into the vitreous, avoiding any posterior segment inflammation. Third is to avoid any vitreous traction and retinal complications. So, among various options, I chose to perform intra-lenticular lens aspiration, in which 2 MVR entries are made, followed by 2 small capsular openings through which lens aspiration is carried out within the capsular bag itself. So this is a minimally invasive surgery and has advantages like no risk of lens matter falling into the vitreous, and the capsular bag remains intact till complete aspiration is done. So in this patient, 2 MVR entries are made, then the aphakic area is filled with viscoelastic, AC is formed with air, anterior capsule is stained with trypan blue dye, the dye is washed and AC is formed with viscoelastic. 2 small anterior capsule openings 1.5 to 2 mm in size are made with MVR blade and whenever possible are converted into small circular rexes using forceps. Following this, gentle hydrodissection is done through both the openings. Then bimanual irrigation aspiration is performed. It is important to follow the principles of low pressure and low flow surgery similar to posterior polar cataract. The bottle height should be around 50 to 60. The vacuum should be 150 to 200 and the aspiration flow rate 15 to 20. Gentle aspiration of lens matter is done without causing any traction on the capsular bag. At this stage, the irrigation cannula helps to support the capsular bag as well as hydrates the lens matter, aiding in its easy removal. When half of the lens is aspirated, then hands should be exchanged for complete lens aspiration. As you can see, the bag is completely intact. It is formed with viscoelastic and then the bag can be safely removed using a vitrectomy cutter. Following this, anterior vitrectomy is done. Pupil is constricted with pilocarpine and AC is formed with air. Uniformly round pupil at this stage confirms that there is no vitreous in the anterior chamber. Peripheral iridectomy is done. The wounds are then sutured with 10O monofilament nylon. The patient is rehabilitated with aphakic glasses on day 1 and is planned for scleral fixated IOL at a later stage. This technique is a safe, effective and simple. It allows complete lens aspiration even in extreme subluxation under direct visualization. Peripherally displaced lens makes capsulorhexis and lens aspiration difficult. However, with this technique, irrigation cannula helps to center the capsular bag, allowing better visibility and complete aspiration. The anterior chamber is well maintained throughout the procedure. There is no risk of lens matter drop. Thus, this technique is specially used for anterior segment surgeons to perform the lens aspiration safely in subluxated lenses. Thank you.